You've been evaluated in the emergency department for your laceration. Now let's take a moment to understand what a laceration is and how you can care for it at home. A laceration is used to describe a deep cut in your skin. It will usually require stitches or staples to repair. If superficial, your laceration may be repaired with surgical tape or skin glue. Now that you're preparing for discharge home, here are some tips for you to take care of your laceration at home. If you receive stitches or staples, keep these dry for 24 to 48 hours. After this, you can get the wound wet, but do not soak the wound in water, so avoid taking a bath or swimming. After 24 to 48 hours, you can gently wash the area around the wound with warm soapy water and a washcloth. Apply a clean bandage to the wound 1 to 2 times per day. For skin glue, keep the cut dry until the wound is healed. Don't apply any liquids, creams, or ointments to the wound while the adhesive is in place. Don't scratch or pick at the adhesive film, as this may cause it to fall off prematurely. The glue should peel off naturally in 5 to 7 days. For surgical tape or steri strips, keep the cut dry. If it gets wet, blot the area dry with a clean towel. Surgical tape or steri strips usually fall off in 7 to 10 days. For lacerations over areas of the skin with a lot of tension, such as those overlying joints, avoid excess movement of the joint to prevent reopening of your wound. Some wounds that are deep or dirty will require antibiotics to prevent infection. Take these antibiotics as directed by your provider. Stitches and staples will need to be removed by a healthcare provider. The duration for how long these will need to remain in place is determined by their location. For your wound, you may return to the emergency department, urgent care, or your primary care doctor's office to have your sutures or staples removed within the time frame you and your provider discussed. In some cases, you may also be asked to come back to the emergency department for a scheduled recheck to make sure there are no signs of wound infection. Make sure to follow your healthcare provider's instructions on follow-up care and caring for your wound at home. Unfortunately, some lacerations can get infected, and it's important to know what to look for at home. Return to the emergency department if you develop any worsening redness or pain around your wound, pus or a bad odor emitting from your wound, red streaks extending from your wound up the extremity that is injured, or if you have a fever of 100.4 degrees Fahrenheit or higher.